So sadly, we lost another Albany County woman to the virus. She was a woman in her 80s, and my condolences and prayers go out to the family, to the other 116 family members that lost loved ones to this coronavirus, and to all 117. Our condolences and prayers go out to you in these difficult times to say goodbye, and we're there for you if you need us. So again, to the family that lost their loved one last night, my condolences. As of today, we have 1,813 positive cases of the coronavirus, which is only up 4 from yesterday, which is good. We have 469 people in our mandatory quarantine. That's down 70 from yesterday, which is good. And we have 5 people in a precautionary, which stays the same. So far now, we had 5,130 people who have completed quarantine. That's up 116 from yesterday who've completed it. And we had 1,553 tested positive for the virus that have fully recovered. That's an increase of 27 people today, which is good, that had the virus. Unfortunately, we went up 1 person in the hospital, so we're at 13 people in the hospital with a hospitalization rate of 0.71. And yesterday it was 0.66%. We still have 0 people in the ICU as of yesterday, and that number stays at 0. In the average, the last 5 days, we're at 4.6 new positive cases, and we're down from 6.2 from the last 5 days, which is also good stuff. We're still aggressively testing out in the community. We still need people to come out. It's there. Our mobile testing sites into the different communities throughout downtown Albany, in partnership with Schenectady County and Rensselaer County, and also the Rite Aid on Central Avenue and Colony, and as always, UAlbany with the Seth Q Arena and the drive-through. The Seth Q Arena is for the essential employees, and please go out and get tested. And as always, our Priority 1 in Gilliland, thank you for that partnership. But our mobile testing site number is 518-465-4771, 518-465-4771. And then for the everyone else going through UAlbany or the Seth Q, it's 1-888-364-3065. And yesterday we had Warren Street back up and running. We had 48 people go through there, which is great. I announced last Thursday we had 78. Believe it or not, we're still waiting on them results. We haven't got them back. Unfortunately, that's what happens sometimes. Sometimes you get it within 24 hours, sometimes you get it in 3 days, and sometimes it takes a week. So when we get them numbers back, we'll know. I know Dr. Whalen and I will be looking at all the numbers from the protesters and the essential workers that had to be out there, the police and fire, as always, to make sure that this rate's not going forward. So, which is good. So we had a productive meeting on the Capitol Control Room yesterday, and representatives from the State Liquor Authority were on to talk about different things. So as our matrix stays stable and we're going forward, it's all good news. So obviously we're in phase 2, and I was hoping to get to phase 3 sooner this weekend. But some of the things the SLA is allowing, which is great, to any restaurant, so to the restaurant owners that are out there, any restaurant owners or bars that serve food, you can legally now, and I know that was the issue a couple weeks ago about serving alcohol past the property. If you had a deck, if you went into the street, if you went into the parking garage or into the parking lot, you can do that legally now. So the SLA is granting a waiver. So that waiver basically, if you put a tent on your property, as long as all the sides are up, if you rent the property next to your property, it's legal. So, think about that. So if you got a parking lot next to your parking lot and you want to make a lease agreement with that person, you can expand over to there. They're accepting all that, so which is all good news. So, and you don't need to get approval. That's the most important thing. You don't need to get approval to do this. I know Nicole's Restaurant on Delaware Avenue put up a tent in their parking lot, to serve more people, to do it socially distanced outside. I know Domenico's and other places, and Ralph's and a variety of places have done that. You got Cafe Italia on Central Avenue. So a variety of restaurants already have done it, but it's legal. The only thing you have to do, and I want the business owners to pay attention, I always say go to the the New York State website on this, but there's temporary alterations at sla.newyork.gov, which you have 5 business days. You just got to submit your diagram of where the tent is and how much more space you're taking up. They're not going to approve it. They just need to have it on record. So for them to have it on record, it just protects you. So please, we'll try to get this out through the Business Council and other ones in that downtown bid. If you're going to do this, and if you already have done this, all you have to do is just do a little diagram. You don't need an architect. Just do a little diagram on a piece of paper and let them know how much more square footage you're taking over, and make sure the tables are socially distanced. Like we said, they have to still be like 10 feet apart. Everyone at the table has to be socially distanced, and there can't be any sides on the tents. And, to the city, especially the city mayor and to the town supervisors and them, yes, you can close down streets. They can go out. They just have to write that part of their diagram, which is great news. I mean, this is, I think everyone sees the restaurants are doing great. And I know if we don't open up early, phase 3 starts the 17th of June. And if that happens, I think bars and restaurants are going to be more than ready to go forward, which is all great news. It's one of the things about, like, even with McGarry's, they got a lot of space in front of them, so now they can expand out and do it socially distancing to protect the safety and health of the residents first and foremost, which is always important. But this was great news that we got, and the guidelines from the SLA were great. So again, please, to the bars and restaurants, you just got to submit a plan within 5 days. Just make sure you do that. It has to be on record, and you are covered not to be fined, so, which is all good stuff. So as we continue to go forward, one of the other things they clarified, and we got it today, was about garage sales. Garage sales now, it was funny. Thank you to our partner in Indiana, Rapids, Indiana. They actually called me about what we were doing in New York State for garage sales, and I go, man, we overlooked that. Even when we submitted our plan, we didn't even think about that. And you can't think of everything. But you can now have garage sales. Again, it has to be socially distanced, no more than 10 people, and you got to just make sure that it's spaced out for obvious reasons. So that is a go. So garage sales are a go for people that love going out garage sailing on weekends. Please just remember to wear your mask and social distance, and always remember to cough into your arm and consistently clean your hands. So, which is good. Again, all good stuff starting to go, and we're getting there. And we're getting there because people at home are listening. People at home are doing the right thing, and so far. It's been great to see with all this protest going on, and that is not affecting the virus so far that we can see. I'm not saying it's not affecting anywhere else, but so far in Albany County, and I'm watching the whole Capital District because we're in the same control room, it doesn't seem to be affecting us, which is great. That means the protesters are doing the right thing by wearing their mask, and I know they're not socially distanced, but they're doing the right thing and keep that mask on and continue to make sure we go in the right way. Also, we had residents contact my office about the reopening of DMV. We're informed the control room that the DMV will be able to open up in phase 3 for limited personal transactions at scheduled time ahead of time. So if you're going to do business with the DMV on the 17th of June, if we don't open till then, the phase 3, you're going to have to call ahead and make an appointment to do in person. And I think the stuff online is going forward. Trust me, I've been all over this. My daughter turned 16 on Monday, and you know what she wants to do? Get her permit. So this is good stuff going forward. So. Again, we're getting there. The light's at the end of the tunnel. Like I said to everyone, this is a marathon, not a sprint, and we'll get there working together. So also the Small Business Development Center of New York is hosting 2 webinars on phase 3 reopening tomorrow, one for food service and one for personal care. So please, by all means, the business owners out there, or people just who want to educate themselves, the consumers that are going to go out to these places, we like you to hop on the webinar too, because it educates you. And the more people that are educated on this issue going forward is going to make us all safer moving forward together in a partnership and not getting one another sick. So, the food service is at 1 p.m. and personal care service is at 3 p.m. You can register at their website, which I'm posting on the screen right now. So please, if you have any interest in one or the other or both, your home, take it. You know, it's a smart way to go forward. You know, like I said, this almost 14 will be 14 weeks tomorrow that this all started for us, and I think it'll be day 93 tomorrow. I always say this: it's a marathon, not a sprint. We all have to take a step back and take a deep breath, and we'll get through this. And we are getting through this, working together. Because we're New Yorkers, we're stronger together, and we're resilient when we get knocked down, we get back up. So I do want to say to everyone, thank you. Continue to send in your ideas as we go forward, and you know, we'll continue to evaluate this as we go forward and how we're going to proceed. So, Dr. Whalen.
Thank you. My remarks this morning will be short. The numbers are encouraging. The numbers are encouraging, but one thing I can say with certainty is that the numbers, despite their improvement, do not indicate that coronavirus is gone. COVID-19 is still around, and it is still incumbent on all of us to make sure that we're protecting ourselves. The best strategies are the continued widespread use of testing. If you have symptoms, or if you have been exposed, or if you have been in a high-risk situation, such as a mass gathering, please get tested for COVID. It is only through early identification, isolation and quarantine, isolation of cases and quarantine of contacted individuals that we can continue to stop the spread. The spread of COVID has been stopped by the actions of New Yorkers. And it is important going forward to remember that those actions, such as hand hygiene and wearing masks, are going to continue to be essential as we reopen. No one wants a shutdown. No one wants to go back to keeping everyone home. But it is very important going forward that individuals remember that a large part of this responsibility will be theirs. And please remember that going forward so that we can continue in the same direction. Thanks.
Thank you, Liza. And you know what? Again, to your Department of Health and DCYF, probation, DPW, to DSS, to mental health, to the clinic that's run down in your in the health complex. Thank you for everything that you do day in, day out. It has not gone unnoticed, the work that the men and women have been doing to keep our county going forward. When most people were home for the last 14 weeks, they were out every day and, you know, and putting themselves at risk to keep the county moving forward. And I can't thank them enough for what they have done day in, day out to deliver services that it doesn't matter. In the middle of an epidemic, we have to deliver services. And a lot of people don't realize the health department, a lot of great things they do besides, you know, this issue here. And I know someday I'd like to have Dr. Whalen really talk about everything that the health department's made up and what they do. But we have a dental clinic that sees kids and adults that can't afford dentists to take care of their teeth and maintain them and help them out. We have a clinic run by some great people down in that clinic that see people for a variety, not just STDs and other things, but for flu shots and a variety of other stuff that do a great job day in and day out. These are the ones, they're the backbone of our workforce. They're the ones that are doing this day in and day out. So I do want to say thank you to you, to all the workers. And if I left anyone out, I apologize. From the clerk, Bruce Haley in the clerk's office, the controller, Sue Rizzo, which I'll hopefully will be on tomorrow with me to talk about some of the other stuff in our finances going forward. But everyone out there doing your job, thank you so much. Thank you. Again, I want to remind people too, we always have the mental health support to Dr. Jean, his team. Thank you. 7 days a week, 8 a.m. to 8 p.m. 518-269-6634, and to Karen Ziegler and her team, who do a great job for us, for a lot of people. Our 24-hour sexual assault hotline number, area code 518-447-7716, and as always, the 201 number in the New York State hotline. Again, please continue to do the right thing, and I just want to emphasize on what Dr. Whalen has said. It's there. I know most people are feeling it didn't go away. But it's out there, and we're fortunate enough. It looks like we hit our apex. We're down on the slide, and things are looking great, and the numbers aren't going up, and we're continuing to test aggressively. One of the other questions we did have on the control room was they were interested in, and I got to talk to Dr. Whalen about it, they were interested in our slide, the 20 to 29-year-olds, the amount of people in that age bracket, that why is that continuing to go up, and so they were really kind of focused on that a little bit, and but these are things in a partnership. We'll get through this together, being good New Yorkers. So again, thank you.